Hi, my name is Ryan Carney. I'm doing my spotlight presentation today on benzodiazepines, and we're going to look at the history, use, and abuse of one of the most prescribed pharmaceutical drugs. So, what are benzodiazepines? They are a central nervous system depressant, and they have lots of medical uses, including treating anxiety disorders, panic disorders, insomnia, alcohol withdrawal, providing sedation prior to anesthesia, relieving muscle pain, and it's sometimes used to treat epilepsy as well. And how they work, they selectively affect neurons which have receptors for the GABA neurotransmitter, and they focus this in the limbic system and the reticular activating system, parts of your central nervous system. And benzodiazepines increase the inhibitory effect of GABA, and that is what leads to mood alteration and sedation. Some of the effects and side effects that might be found when taking benzodiazepines, these are all pretty universal to different kinds of benzodiazepines, and obviously whatever condition is being treated, whatever effects are being sought after, these might be intended effects or side effects. So sedation and drowsiness, and then that also can cause amnesia, and they cause increased appetite, loss of inhibition. Anti-anxiolytic means that it decreases anxiety. They can also cause euphoria and elevated mood, and physically relax muscles. And then also over here, we have tolerance and dependence, which is also a universal feature of all benzodiazepines and is a risk. So because of that, benzodiazepines are a controlled substance, and they are Schedule 4 in America, meaning that they have lower potential for abuse, might lead to some dependence, but they currently have acceptable medical uses. So here is some more things to look at. So the history of benzodiazepines, they have been around for more than 50 years. So they have a long history, but these are just a couple of landmark events. So in 1960, chlordiazepoxide, which is Librium, was first used, and reports of withdrawal and dependence followed pretty quickly. So it became apparent right from the get that it was going to be a risk. In 1963, diazepam, which is Valium, was introduced. It's more potent than its predecessor, and people started using it for a lot more things. So then by the 1970s, Valium became the most prescribed drug in America. And in 1990, alprazolam, which is Xanax, became the first drug approved to treat panic disorder, and it became the most frequently prescribed benzodiazepine, which it still is today. So it replaced Valium in that regard. In 2016, the FDA added a boxed warning, which is their highest level of warning, advising against opioid and benzodiazepine combinations because of the increased risk of overdose. And some common brands and variations are Xanax, which is alprazolam. It's fast acting. It treats panic disorders, and it has a higher abuse potential because of its fast onset and short half-life. And then we have Librium, chlordiazepoxide, which is used frequently for alcohol withdrawal. Klonopin, which is clonazepam, is a higher potency but longer acting medication, so it's good for treating anxiety disorders. And then Valium, diazepam, which we covered, and Ativan, which is lorazepam, is a fast-acting and potent medication, and they use it a lot in hospitals and things like that, so it might be a little bit less common to find in a medicine cabinet or something like that. And then here are some of the street names that you might hear are benzos, bennies, bars, Xannies, K-pins, and footballs, which are that specific presentation of Xanax. And these are just some of the chemical structures of the different kinds, which I find really interesting. So here are some facts about chronic use and abuse of benzodiazepines. So starting up here, we can look at the physical dependence and psychological dependence, which are a risk regardless of whether or not somebody is using them under the care of a physician, exactly how they're being prescribed them, or if somebody's taking them illegally. Benzodiazepines build tolerance fairly quickly, so increasing doses to counteract the tolerance is going to cause physical dependence. And if the person were to stop taking them, it would create unmanaged anxiety, worse than it was before, probably, and that's called rebound anxiety. And so then we're using more of the benzodiazepine to treat that anxiety, and that just feeds into a cycle of abuse that it can be really hard to get out of. Non-medical use occurs in 2 to 4% of the US population, and it's typically a secondary drug of abuse, meaning that people who are abusing benzodiazepines are likely to have already been abusing cocaine or other narcotics. Some overdose risks and symptoms. Benzodiazepines used alone have a low overdose and toxicity risk, but abuse often occurs in users of other substances. So overdose risks substantially increase if they are combined with alcohol, opioids, or any other central nervous system depressant. And that is because it can slow vital functions like respiratory function enough to become fatal, so you could just stop breathing. Another risk is if the user has pre-existing respiratory issues like asthma or emphysema, again, because of respiratory function being suppressed. And then another risk is if the benzodiazepine is acquired through any non-prescribed method, like buying them from the street, sharing prescriptions, or buying them online. So unsafe sources. Drugs obtained outside pharmacies can be counterfeit, and that could be getting them from online dark web retailers. They could be making their own pills. It's a pretty known existing problem. Any pill bought secondhand risks contamination, and it could include fentanyl or other unexpected chemicals. So it's really important to make sure that you're only taking benzodiazepines that you know came from a pharmacy. And over here is a example of what a real Xanax bar looks like and what a quote-unquote fake one looks like that was bought in some other method. So they look really similar, and if someone just handed that out on the street, somebody probably wouldn't think twice before taking it. In 2021, 14% of opioid overdose deaths involved benzodiazepines, and 1/3 of recorded benzodiazepine prescriptions were also given an opiate prescription. So those two things together are extremely dangerous, and overdose rates in patients receiving both increased 10 times the amount. So it's really important for people to know about that, to be on the lookout, and to make sure that they are following their doctor's orders exactly and are aware of the potential outcomes if dosages were to be altered. These are some photos of what Valium and Klonopin look like. The Valium has a V cut out from the middle. The K has a K cut out from the middle. They come in all different colors to signify the dosages. Those are the brand name ones, though. It's a lot more common to come across generic ones, which come in endless combinations, so they can be hard to know exactly what you're looking out for. So it's always important to make sure that you identify the pills. And sudden discontinuation can rarely but possibly be life-threatening. So if somebody is dependent on benzodiazepines, so now what? We're going to look at detox, harm reduction, and safe management of benzodiazepines. So if treatment were to be discontinued, the onset of withdrawal symptoms would happen in about 12 to 24 hours after the last dose, and peak in intensity around 24 to 72 hours later, and then it would taper off from that, but it can take an extremely long amount of time for any withdrawal symptoms to be completely eliminated. Some of the withdrawal symptoms that can be expected are rebound anxiety. Like we discussed, that it can come back worse than it was before. Withdrawal can cause nightmares, insomnia, nausea, vomiting, anorexia, and really just a intensely unwell feeling. Some of the dangerous withdrawal symptoms are that it can cause seizures in highly dependent users, and it can also cause delirium. So it's really important to not withdraw alone and to make sure somebody else knows what you're going through, because you might not be capable of making decisions for yourself, and you need to make sure that you're safe. So safe detox needs to be monitored by a professional. Don't do it at home alone. Always seek help for this. Benzodiazepines are one of only a few substances that the withdrawal process can be fatal. So that is something to look out for. Prescribing practices are another way that we can safely manage benzodiazepines. And some of those ways are to treat benzodiazepines as a second line of defense. For a long time, it was the first thing that was prescribed as soon as anxiety and panic symptoms were brought to a doctor, but physicians are starting to think of it more as a second line of defense, to try other alternative medications first or in combination with the benzodiazepines to lessen the amount that needs to be taken. Avoiding opioid combination prescriptions is vital for decreasing the overdose risk. Screening for substance use disorder is really important because, like I mentioned, people who are abusing benzodiazepines are likely to already be experiencing a substance use disorder. And if treatment is less than 3 weeks of using the benzodiazepines, there's a really lowered risk of forming a dependence. And treating co-occurring disorders can mean that treating any other psychiatric condition or the original anxiety through therapy, other medications, but it's really important to make sure that the anxiety is still being treated. Some education that is important to safely managing benzodiazepine is making sure that patients understand risks, making sure that they know the dangers of mixing it with opiates or other drugs, but also the teen education to include pharmaceuticals. I think that pills and pharmaceuticals can be seen as safer and more reliable, and falsely give the sense that they carry less risk and danger. And making sure that people know about how to safely withdraw. In 2014 to 2016, benzos were prescribed at 66 million doctor appointments. And that means that for every 100 office visits to a doctor, 27 of those resulted in benzodiazepine prescriptions. So they are extremely popular and that's a lot of people that need to be looking out for these risks. And to mention some harm reduction options, fentanyl test kits are a little strip that you can scrape off just a tiny bit of a drug onto to test whether or not it contains fentanyl. I do want to point out that these are not considered legal in Idaho. They're considered drug paraphernalia. However, they're legal in a lot of other places, and so if you are somewhere else or you are from somewhere else, that's just something to keep in mind, that these do exist, and hopefully Idaho will change those laws soon in light of all of the opioid overdoses that are happening in our state. And then Narcan, since a large proportion of fatal benzodiazepine overdoses also involved opioids, and the reverse of that as well, it is important to reverse opioid overdosing by administering Narcan, even if you think that they've only consumed a benzodiazepine, you never really know. So it is best to administer it if you have it. And here is the Idaho Harm Reduction website link. And so that is a great place to get Narcan and other harm reduction supplies and to get connected with other resources in Idaho. And these are the references that I used, and